Surrogacy is a very controversial topic, and there are many countries that ban surrogacy. And I understand the reasons for that, because it can be handled very poorly, and there can be serious ethical problems with it. So it's very important, if you decide that you're going to use a surrogate, to make sure you work with a center that is highly ethical and understands the problems. Because there's so many women who cannot have a baby without a surrogate. It's sad. There are many women who are born without a uterus. There are women who lose their uterus for one reason or another, and they have no chance of having a child. And something that's extremely rewarding to me is this woman, let's say one that was born without a uterus, who never thought she could have a baby. She finds out she can have her own biological child by working with an egg donor. By working with a surrogate. And it turns out that California is probably the #1 place in the entire world that couples go to use surrogacy, because there are laws, there are strong laws on the book that protect the intended parents. There are laws that protect the surrogates. And so it's a great state to do it in, because everything is open. And you don't see the kind of abuses that have been very common elsewhere in the world. In fact, in California, you and your partner's name go on the birth certificate. There's nothing on the birth certificate about having used a surrogate. So it's extremely nice to do surrogacy here in California. Now, how do you pick a surrogate? It's difficult, because there are many women who want to be a surrogate, but there's only a small number that are actually good surrogate candidates. And how do you find them? You have to look at everything. We examine and we screen surrogates to such an extent. Every test you can think of, we do, because we want to make absolutely sure that they're doing it for the right reason. We want to make sure that they're going to get pregnant, and we want to make sure that there's not going to be any problems during the pregnancy, at least as sure as we can be. So we probably only take 1 out of 20 women who apply to become a surrogate. And it takes a lot of skill to know when a woman is going to be a good surrogate. Myself, I actually have 2 children through surrogacy. So that was many years ago, and I became very good at looking at all the things that you need to consider when you choose a surrogate. But in the end, of course, the most important thing is, will they take your embryos, and will they create a healthy baby, a full-term baby, a baby that can become everything it can become, one that can reach its full potential. And so we put a lot of effort into selecting the right surrogates, and then matching the right surrogate with the right intended parents. Some women are excellent surrogates, but they're not right for those intended parents. And so part of our job is to find someone who's right for them, because the surrogacy process can be very stressful. When another woman is carrying your baby, that's stressful. On the other hand, if you're with the right woman and she's communicating with you, and you know that things are going well, it's really a wonderful process. So I care very much about surrogacy. For the many women who must do it, I'm glad that it's available. So I'm absolutely thrilled that we can offer surrogacy to the many women who need it to have a baby. And for many of these women, there really are no other options. In some cases, they're unable to become pregnant, and in many other cases, it's just unwise for them to become pregnant because they have a medical problem. And if they were to become pregnant, then their life would be at risk. And so surrogacy, I think, is such an essential part of infertility treatment. Everything has to be handled correctly. Everything has to be handled ethically. Now, choosing a surrogate, it's a challenge. It's a challenge, because there are many women who want to be surrogates who are not great surrogate candidates. And so we look at many different things. One of them is age. I think the best age is probably 25 to 38. I don't want the woman to be 40 at the time that she delivers, but many women in their late 30s do extremely well. And we screen them so carefully that I'm very comfortable with those women. Now, sometimes women who are younger also want to be a surrogate. Is it a good idea to have a surrogate that's 21 years old, for example? Usually not. Usually they're not mature enough to be a surrogate at that stage. But sometimes we have had women who are mature enough and they've been wonderful surrogates even in their early 20s. So I think the most important thing in terms of age is not to think that just because someone is a certain age that they're going to be fine. It's not that. You have to look at the individual and see if they're where they should be at that time in their life. And speaking of where they are, one of the things we look very carefully at is where they live. We actually do home visits and we look at the house that they live in. We make sure everything is clean, everything is taken care of. We look at their social situation. We make sure that it's a stable situation and that they have support if something happens during the pregnancy. We make sure that their relatives or friends that are nearby that can help them if there's a problem during the pregnancy. We also need to make sure that they've had pregnancies in the past and that those pregnancies had no complications associated with them. If a woman has ever been pregnant and had a complication during that pregnancy, then she's not a candidate to be a surrogate. The only women we work with are those that have had pregnancies before and the pregnancy has been completely without any problem. The other thing we look at is the weight of the woman, because when a woman is quite overweight, it can actually affect the baby. And so we make sure that all women are in the correct range, because our goal is to help create babies that are healthy, not babies that have problems. We want the parents to be happy with these babies and to be able to guide these children into successful adulthood. Hi, this is Dr. Sam Wood from Gen 5 Fertility in San Diego, California. If you're looking to have a baby, we'd certainly be happy to take care of you. We love our Chinese patients very much. But wherever you decide to go, I hope that you're successful. It's an amazing thing to have the family that you want.